speakers for the day. I'm going to just mention we have Dr. Didier Pittet, who is going to be our first speaker. Dr. Pittet is the director of the Infection Control Program and the WHO Collaborating Center on Patient Safety at the University of Geneva Hospitals and the Faculty of Medicine in Geneva, Switzerland. He has honorary professorships from London, Hong Kong, and also in Shanghai. And he's been the lead of the World Health Organization's first Global Patient Safety Challenge, Clean Care is Safe Care. He has received a number of lifetime honors, and including one as a former British Commonwealth country. Many of us are recognized the Commander of the British Empire, which was awarded by Her Royal Majesty Queen Elizabeth II for his services in prevention of healthcare-associated infections and in leading the hand washing really on a global basis. He's published over 400 peer-reviewed papers and has been very engaged in innovation activities in his hospital in Geneva and in Switzerland. Dr. Pittet is unable to be with us today, but we have a live video link. He is a lifelong best friend, just collapsed and passed away suddenly last week on Thursday. And I'm very grateful. I think we should, very gracious of Dr. Pittet to actually provide us with his slides and a live video link. He's unable to be with us today because he has a funeral that he has to attend this week, and he felt that he had to be there for his the family and colleagues and friends of his lifelong best friend who passed away suddenly. But I'll turn the podium now over to Dr. Pittet, who will outline for us some of the local issues that they've looked at in Switzerland and how that spread globally, and then also look at some of the global successes within Switzerland and how they look at their innovation. So with that, I'll turn the podium over to Dr. Pittet in Geneva. Didier.
Okay. Well, thank you very much for this kind introduction, John. I'm very happy to be with you today. I'm happy we could use this video conferencing system. I'm very sorry not being able to be in Calgary today and enjoy the Swiss cheese in Calgary. As you understood, it was not possible for me to come, but I'm very happy if I can contribute to the success of your day and your activities in your own place. So without further ado, I will start with the topic that John has given to me, Swiss innovation. For these, I will be actually going through three different topics that would first describe innovation from local to global. Secondly, I will discuss why is Switzerland so unique, or is Switzerland unique? And thirdly, I will describe innovation office at the University of Geneva Hospitals, as you will understand, because over the past 6 years, I have been in charge of innovation at our institution. I will start with the discussion of an example of innovation from local to global. Welcome to the hospitals. Infections are waiting for you at the entrance door of the hospital and will certainly complicate your hospital stay, as you know. The burden of disease is huge, because worldwide we have estimates of 1.4 million patients getting infected in hospitals only all over the place. So definitively a very important challenge for prevention. We all know about the most effective way to prevent infections, which is actually promoting hand hygiene at the point of care. Unfortunately, compliance with hand hygiene practices is rather low, usually below 40%, according to most of the studies published in the literature so far. Importantly, however, 18 years ago, an individual in Switzerland named, let's say, Dr. P, 18 years ago, thought, I have an idea. I will go around this idea, and you will understand why this idea drove us to the concept of innovation and technology transfer.
Immediately by doing epidemiological study at our institution, we could nicely understand that hand hygiene or hand washing using soap and water should be considered as an action of the past, and that we should consider alcohol-based hand rub as the new standard of care in healthcare. The reason why that was that simply healthcare workers had no time to clean their hands at the appropriate time. So we recommended at that time the system to be changed. We call it system change. You replace soap and water hand washing by alcohol-based hand rubbing at the point of care. The way we did that at the University of Geneva starting in 1995 was to actually promote the use of alcohol-based hand rub at the point of care using little hand rub bottles that each individual in the hospital would carry with him or with her on the pocket of the white gown, using very simple instructions of how and when to use alcohol-based hand rub. Education was something that we simplified by using cartoons and posters that were very easy to understand by healthcare workers, as you can see on the slide. So education was another of our strategy to change practices. We used the walls of the hospital in a technique named the talking walls in order to promote hand hygiene, reminding people about the importance of actually healthcare-associated infections and the way to clean hands and the way to reduce infections in the hospital. On this slide, you see Father MRSA speaking to little son MRSA. My son, if they don't get me, you will become multi-resistant, is telling Father MRSA to little son MRSA. Hand rub is the natural killer of cross-transmission, is another of our posters. Those posters were called workplace reminders. They were there where staff could work in order to remind people about the importance of hand hygiene. Progressively, however, bacteria in the hospital became very frightened by our action, finally going to Sigmund Freud, telling him, Dr. Freud, in this hospital, it becomes impossible to cause infection anymore. Well, it looks a little funny, but actually this is what we call safety culture. This is the change in the safety in the institution that is placing safety at the top of the agenda of the institution. Geneva University hospitals against dirty staff, the way we called MRSA at that time. War has been declared. In the meantime, we repeated the first study that we did in December 1994, and as you can see, progressively, compliance with hand hygiene on the vertical axis improved over time. Between December 1994 and December 1997, it moved from an average of 48% to an average of 68% over a 3-year period, mostly explained by the increased recourse to alcohol-based hand rubbing as the main way to clean hands in hospitals, in orange on the slide. In comparison, as shown in yellow on the slide, you see that hand washing with soap and water remained very stable over the study period. This is what you call monitoring hand hygiene and feedback of the performance of healthcare workers at the point of care, so that people could understand the importance of hand hygiene. In the meantime, we monitored hospital-wide nosocomial infections using actually prevalence studies that were conducted yearly. As you can see, over the same period of 3 years, we reduced infections by 50%, with considerable cost containment and cost reduction of the all means used to treat and to actually handle healthcare-associated infections at our institution. We could demonstrate the cost effectiveness of the study after 8 years of follow-up, and this was published in Infection Control Hospital Epidemiology in 2004, which means more than 8 years ago. So in summary, we described the effectiveness of a hospital-wide program to improve compliance with hand hygiene and reduce infections. It was a multimodal intervention. The critical element for success were system change, education of healthcare workers, monitoring and feedback of performance, reminders in the workplace, strong administrative support, and leadership and culture change that were the parameters for success. After that, the so-called Geneva model of hand hygiene promotion was reproduced with success between 2002 and 2005 in single hospitals in France, Belgium, USA, Australia, in multiple hospitals in Hong Kong, Australia, and Belgium, and in national promotion campaigns in Belgium, in the United Kingdom, and in Switzerland. After that, the World Health Organization, who was launching the World Alliance for Patient Safety, asked us whether we could be able to lead the so-called first Global Patient Safety Challenge, Clean Care is Safer Care, in an idea to reduce healthcare-associated infections worldwide using hand hygiene as the cornerstone for action. While the program was launched, the first Global Patient Safety Challenge program was launched from WHO headquarters on the 13th of October 2005. We were at that time video connected with different hospitals all around the world, and we were actually embarking into the program asking people to really endorse our strategy. Nowadays, asking ministries of health to endorse the strategy for infection prevention that we promoted since 2005, 130 countries have committed to address healthcare-associated infections that represent actually 92.5% of the world population that is currently covered by the strategy. The core recommendation of the strategy is, of course, the universal use of alcohol-based hand rub at the point of care, as illustrated by this figure, which is the logo of the campaign that was actually carrying the campaign for the 2 first years of that campaign. Clean Care is Safer Care.